But I'll start by introducing myself. My name is Molly James, and I'm the Specialty Care Coordination Director at Project Access Northwest. If I haven't met you, I would love to have a chance to at some point. So please let me know. We can just, have a quick Zoom meeting and meet everybody. But otherwise, I've been with Project Access since 2010, and I'm just thrilled to have this meeting to be able to give you updates on our existing programs as well as introduce you to some new programs and some new staffing. So today on our agenda, we're going to have a welcome by our President and CEO, Gary Renville. We'll be talking about some of our legacy programs at Project Access and some updates to those, as well as introducing two new programs, and then talking about all the different ways that you can refer patients to Project Access. So I would like to introduce Gary Renville, our President and CEO, to give sort of our opening remarks. And please keep yourselves muted if at all possible. Thank you so much. And Gary.
Good morning, everybody, and thank you, Molly. Hello, amazing referral coordinators. Hello, amazing staff of Project Access Northwest. Molly, your initial slide, your cover slide to today's meeting was welcome to the referral care coordinator meeting, and it had not one but two exclamation marks on it. I think that's just indicative of our excitement about spending time together this morning with you, our partners, and with you, our community, in what for many has been a challenging week. And that doesn't even include the time change that we all just recently went under. So I'm sticking close to my coffee. I did double check and triple check that today is in fact Friday, and I'm very thankful for that. I will not go into kind of specifics on the national election or on local election results, but I did want to read to you and give voice to what we at Project Access Northwest sent out in the wake of the presidential election. So just want to give voice to that, let you know where we are coming at in terms of an organization and what we see kind of going forward. So for those who might not be looking at your screens, I'll go ahead and just read this very short message to you. So an election in reflection. In the wake of the presidential election, I want to reaffirm our dedication to our mission and to the communities we serve. We respect the democratic process and the voices of the voters. We also believe that this is a time for reflection and recommitment to the common values that unite us. At Project Access Northwest, our mission transcends politics. It's about serving our community's most vulnerable and connecting them to the care and resources they need every day. Your support brings relief from pain and suffering that provides people with life-changing care and builds stronger, healthier families. Our dedication to ensuring equitable access to healthcare remains unshaken. We will continue our mission to support underserved communities and seek solutions in collaboration with all stakeholders. A person's well-being shouldn't be influenced by their location, the language they communicate in, or their financial status. Unfortunately, this is often the case. We are committed to making a difference. We invite everyone, including all of you that are on the call today, our elected officials and others, to engage in meaningful dialogue about healthcare access. Together, we can forge a path to a healthier, more equitable future. Thank you for those who are on the call for your unwavering support and for believing in our shared vision. Thank you for all the work that you're doing. Certainly, if you are feeling if you're feeling tired, if you're feeling anxious, if you're feeling any of the feelings that might be associated with that, I just want to pause and say that I recognize that may be the feeling out there, but I also want to make sure that you each are taking time not only for yourselves, but taking time to just have that moment of realization that the work that you're doing continues, and that the positive impact that you have in communities continues as well. And again, I just want to thank you for your work. Molly, I'll turn it back over to you.
Thank you so much, Gary. Appreciate your time this morning. So looks like our most people have joined the call. So let me get my screen back up and we can get started. Again, feel free to put any questions that you have, comments, thoughts in the chat, or just let me know and feel free to jump in. And that also goes for staff. So if you have something else to say, feel free to do that. All right. So let me get okay. So we've got let me get that. Okay. So thank you to Gary and moving on. So we have got lots of super exciting programs. We are introducing 2 new ones today, but we still have our existing legacy programs of specialty care coordination, pro bono counseling, and premium assistance. We also, for a while, have been working with Unite Us and the Northwest Kidney Center. So those programs all are still in place with some exciting updates, as well as our 2 new programs. The first one is the Community Resource Connection, or MTP 2.0, and the second one is Dentist Link. If you have questions about after this meeting about which program is which, who to call about what, which, part of the state it serves, what the qualifications are, etc. Here is a handy dandy program at a glance page. And again, all of this will come out after the meeting, so you should have this on hand moving forward. But today, I'm going to be covering the specialty care coordination piece and the premium assistance piece because our premium assistance lead is dealing with open enrollment. So I'm going to cover her section as well. But I will start today with covering the updates for specialty care coordination. Hold on. There we go. Okay, so what's new in specialty care coordination? We do have some new providers. We have a new dermatologist at Pacific Medical Center. Very excited about that. He is willing to see quite a few of our patients, so that's just wonderful news. We have a new provider at Franciscan out on Kitsap named Dr. Freyback. And then we have a new, very exciting outpatient clinic on at Swedish Cherry Hill. We currently have one at Swedish First Hill that many of you are aware of. They do dermatology, they do very minor general surgery, they do IUD replacements, all of those things, and they accept Medicaid. So it's very exciting that now we have two clinics kind of running simultaneously for those issues. We do know that dermatology is really hard to find right now for Medicaid patients, so this may be a good resource for you. All right, admitting people in. There we go. Okay, we do have new enrollment forms. These are now on our website. They're available in English and Spanish. Fairly minor changes, but we would love if you would start using these. The biggest changes, and again, I will send these out after the meeting as well. The biggest change to the first page is we took out a question about COVID. Nobody seems to be asking anymore. And we put in a section about if your clients need other services. So if they need dental, if they need any other resource connections like transportation, housing, or if they need counseling. So that is on the first page, and you can just have them fill that in. Or if you're filling it in with them, you can help them understand what that question is, and those programs will reach out to them separately. The second page of the enrollment form, again, totally optional. This has always been optional. They don't need to fill it out if they don't want to, but they can. And what this page is very similar to what we used to have, but it is now, we're kind of separating out the community resource connection, and we'll get into that in a little bit. But if patients do need anything else, they need transportation, legal services, anything like that, they're welcome to fill out this page. We do request that they actually write something in here about what they're actually looking for, whether it's transportation or they need help, paying their utilities, whatever it is. Often this middle section of the form is people are writing in more information about their medical referrals, and we don't really need that. What we need is more information about the other resources that they need so that we can make sure to match them up correctly. So there's that page. The third page of the enrollment form is unchanged. And again, the second and third pages are totally optional. Patients can fill those in or not. And again, I'll be sending both of these out after the meeting, both in English and in Spanish. Any questions on that? Okay. Imaging referrals. So we get a lot of imaging referrals, as I'm sure all of you know. And lately, we've been getting a lot of increased pushback on them. Um, and the biggest thing that's come up is that CPT codes don't seem to be as accurate as the clinics would like or exact. So I just put in here a really good resource, and it is through Providence, through their imaging department, of exactly what imaging CPT codes are accurate for what the provider wants to have done. So we also do request that there is an explanation on the referral of what the provider would like, with a confirmation that the CPT code matches that diagnosis or that reason for the referral. The part of the body is the same, the side of the body is the same, and those kinds of things. So just a resource for you, so that stuff doesn't have to come back to the clinic and be changed and then be resent back. It just makes it a lot faster. One additional note is that Swedish Edmunds they accept project access for imaging, but they also require that patients fill out their own charity care, and it's right across the hall from imaging. So just a note for all of you, that is the case. If you ever have any questions about that, feel free to give us a call. Um, and if your patient ever gets the bill, as we've always said, please send us a copy of that bill right away. Don't have them pay it. That is update on imaging. The second one that we've been getting some pushback on is sports medicine versus physical medicine and rehab versus physiatry. Those three specialties really do overlap each other quite a bit. However, and in the past, we've been able to send the patients with any of those specialties to within that specialty group nearest to their home and the fastest appointment available. We've been getting a lot of pushback if a referral is made out to physiatry, sports medicine will not see them anymore, etc. I wasn't even really sure what the difference was, so I actually did write out some definitions that I found. But I think what's more kind of helpful is the next page, which is which diagnoses commonly go with which specialty. And again, whatever your providers write on the referral, that is where that patient will be sent. So just an FYI on that. Any questions on that? All right. Moving on. So just some general reminders. We have very few to no options for Medicaid patients in Snohomish and Kitsap counties. Those patients will need to travel to King County. We have seen an expanded number of our patients with Medicaid due to the expansion that happened in June. So those patients will need to travel to King County. Again, we do have other resources available through our community connections programs. And so if you do have a patient who needs help with transportation, you are very welcome to fill out that form as well. And we can try to connect them with transportation services to help them get to their appointments as well. The other thing is we've had quite a few patients calling us to make an appointment before we even receive the referral. So please do not give the patient a referral or have them fill out the form and then immediately have them call us to schedule their appointment or their surgery, um, because we just don't have the capability, and often we haven't even received the referral yet or it's not been processed. And I think I had a question in the chat. Let me check that really fast. Um, Okay, so clients are being required to provide a social security number in order to apply for financial assistance or charity care from hospitals in Snohomish County. I have not heard that. So let's see. That's really interesting. I'm going to actually do some research on that and get back to you on that. Okay. We do not ask. Yeah, we will follow up on that for sure. We'll be talking about this a little bit later, but Project Access does not ask for immigration. In fact, we would really prefer not to have that information in our system. So if they come through Project Access, they will not have they will not be required to provide that information. If this is related to the imaging referrals and patients having to apply for charity care there, we'll follow up on that and get back to you on that for sure. Yeah. Any questions on that? So other partner news, the New Hope Clinic, which was in South King County, has closed, which is too bad. That was a lovely little clinic that we worked really closely for. We also have a partnership with a group called Roots and Wings, and they have partnered with MedShare um, to help free and charitable clinics to find durable medical equipment. And so just there's the website right there, medshare.org. I just thought I would share that with you all so that everybody was just in the loop on that. A good time frame to ask a patient to wait before calling and trying to schedule. So they are welcome to call and check in on a referral. It's usually a couple of weeks before we have all of the materials ready, but we will call them to schedule. And so once an appointment is available, then we will be in touch to schedule. That was another question from the chat. So don't forget, this is just a reminder, every Friday from 9 to 10, we have an open Teams meeting. And I think, yeah, open Teams meeting. Typically in that meeting is myself, Martha, who is just the general project access guru, but also deals with billing, and then Heather, who is one of our RNs. And so you are welcome to just jump on and say hi, introduce a new coworker, or ask specific questions about specific referrals or referrals that you're thinking about sending, and just unsure kind of what we need, etc. There's no new information being presented at those meetings. And so, um, you know, you don't have to join on. Again, totally optional, but we just love to see everybody. So always feel free to jump on that. And that's every Friday morning from 9 to 10. Going through our access updates. So King County, the demand exceeds capacity. It says ophthalmology on here. It's actually eye surgeries. So regular ophthalmology, diabetic eye exams, etc. Those are moving along just fine. Eye surgeries are taking quite a bit of time to actually get scheduled, but they are being scheduled. It's just taking time. Neurology and PT are also, they have quite a big waiting list for both of those. Um, the same is actually in Snohomish County, exactly the same. So eye surgeries, neurology, and PT. And then Kitsap County, there is no current wait time at all. So all of those specialties are open and available. Access to our beta database, this again is just a reminder. We actually now have 3 different systems that have direct access into our database. It's not something that we would ever, that they can make notes on or anything like that, but you can see where all of your patients are at any given point, and see what is pended or see where a patient's going for an appointment, etc. The cost of that is $300 per user per year. And that is the cost from our database system. We're not making a profit on that. But if you're interested, please reach out. You can reach out to me anytime and we can get you set up with that. It's been really useful for the clinics that are using it. You also can refer patients through our web form. And I will be, again, we went over that at our last referral coordinator meeting, but I'll be sending out information on that after this meeting as well. Just another way to hopefully streamline things for everyone. Any questions on either of those? So Unite Us, which is a community hub of different resources for patients that people have, so that people who need other resources have access to that. We're typically now using Unite Us for Snohomish and Kitsap patients. And these are the numbers this year. So for 2024, the highest need has been food assistance, followed by just general income support. Our specialty care coordination numbers, we've had 1,300 referrals as of yesterday, with almost 3,000 appointments. Northwest Kidney Center, which again just deals with patients who are needing a dental clearance for a transplant. And that comes through the Northwest Kidney Center only. We've had 16 referrals and 13 appointments. And again, Unitas has had 138 referrals and 78 appointments. Just a reminder again, every Friday, you should be getting a packet of information about any patients who've had any direct action on their referrals that week. So that would be any referrals that are approved, any referrals that are pended, including the reason for the pend, any referrals that have been appointed, even if the appointment is not for a month, you will be notified as soon as an appointment is made, and any referrals that are closed. So you should be getting that every Friday. If you're not, or you don't know where that information is going, please let me know and we will confirm the information about where that information should be going. We do really love it when we can send it to an email. It seems to be an encrypted email. It just seems to get to the right people a little bit better than sending to a generalized fax. However, very happy to send to a fax. We just want to make sure we have all the right information. So if you're unsure, please reach out and we will confirm that we have the correct information for your clinic. Next, I am going to be introducing my colleague, Charisse Ezel. You have actually met her before. She's been at Project Access for almost exactly a year, I want to say.
Yep.
And Charisse is in charge of our pro bono counseling program, has done a stellar job getting it up and off the ground. And so she's just going to be doing a quick overview and any updates.
Awesome. Thanks so much, Molly.
Yeah,
Can
thank
everyone
you.
hear me okay?
Yep.
Good. Okay, perfect. So I wanted to take this opportunity again just to reintroduce the program and just let everyone know how it works and answer any questions that you all have. Please feel free again, just as Molly stated, to put any questions in the chat. I'll be here the whole meeting. So if you have any questions that come up later on or things you think about, please do feel free to ask those. So quick overview, we provide free counseling services that are available to adults at this time. We're not serving children, and that's just based on the providers that we have. So right now our providers are just seeing adults, so that's 18 and up, living at or below 300% of the federal poverty level. In this slide, I I do have the link here that goes into more specific details on our website. Feel free to take a look at that when we do send those slides out. Clients can be located anywhere in Washington, and we use a HIPAA compliant teletherapy platform. So most of the therapists and counselors are using teletherapy at this time. We do have some counselors that have in-person appointments available. So even if a client is like, I want to be seen in person, still send them over and we will support them getting connected with the provider that is able to provide that, but just know that it is slim pickings for that. So the benefits for clients is that they'll get free access to high quality mental health care. We really are pushing towards a thought process and model that you don't just get who you get because it's free. You're actually going to get someone who is the best fit for you. So we have them go through a screening process and they complete our online web enrollment form. And that's really simple to fill out. And anyone can support the client in doing this. So if you would like to fill it out on their behalf, you would just put your information in the form and let us know best way to contact them. And you can also do this with them. So as long as you're filling that form out, we will get the screening process started for them and with them. And again, we really want to just promote the fact that you don't just get who you get. We are very intentional about the matchmaking process with our counselors and the clients. Next slide, please. Oh, next slide. Thank you. So I do want to stress that we are not a resource. Oh, if we could go back, I'm sorry. Yeah, so we are not a resource for crisis care. However, we do have a internal crisis process. But I will say that if there are complex behavioral health needs that are related to psychiatric concerns, for instance, medication management, we will support in providing resources within the community. That is, again, a part of our matchmaking process, and we take it very seriously. We will do case management for them in that regard. I'm happy to report we actually do have a new staff person that has joined us. He is our behavioral health focused care navigator. His name is Dennis Smith, and he's actually on the call. And I'm super excited to have him here. But with that being said, again, we will focus on getting case management needs met for that individual if we don't have medication management for them. So we do have 3 providers that are able to provide medication management, but I'm very protective of their time. And so we want to make sure it's a really good fit. So let's say a client does present to us in crisis. We will support the client in getting stabilized and then bring them back into the PPC program. Next slide, please. Awesome. So this is our internal crisis management protocol. And I thought it would be really helpful for all of you to know that, again, we're not a crisis particular focused agency at this time, but we will support the client in getting connected with 988 through a warm handoff. And then we also do follow up with them in 48 hours of that call being initially coming through to us. So this is passive or active suicidal ideation or homicidal ideation. Passive is I just feel as though, I don't want to live anymore, but no real plan, no intent. Active is obviously the opposite of that. They have means and plan and opportunity to do that. So what we'll do is we'll provide immediate support, determine where they are, gathering key demographic information to ensure that we can support them. We will call 988 if this is a passive suicidal ideation, homicidal ideation phone call while the client is on the phone. We'll explain that process to the client, obtain their consent. We have scripting for all of this, so we are prepared if that does in fact happen. We will introduce the client to the crisis counselor, provide any relevant context, because sometimes when those individuals are agitated or in that crisis space, it can be difficult to keep telling your story over again. So we take that on to support. And then we work to keep them engaged if there is a hold time, just to make sure that they're getting connected to that counselor. If a client is experiencing active suicidal or homicidal ideation, we will call 911 and we'll use a 2 care coordinator approach. And so what that looks like is we'll actually have a Teams chat in which we will be talking with someone on that crisis protocol, letting them know we need outreach to 911. Here are their demographics while we are still keeping that individual engaged on the phone. So we do have, I believe, a pretty robust process that we've kind of implemented from various other crisis programs, as well as our direct connection with 988, which is pretty amazing. And again, our follow-up will look like a client will receive an email follow-up from us, as well as a call 48 hours post their outreach to us. And the reason for that is to see if they've been stabilized, if those resources that they were given during that crisis phone call were able to be outreached and those types of things. And if they are stabilized, we will then bring them back into the PBC or pro bono counseling program to see one of our therapists that will manage them post-crisis. We'll also be connecting them with other resources. As Molly mentioned, we've got fantastic programs within Project Access that we will be connecting them to. Again, we want to make sure that we're meeting them where they are. So if their crisis is related to housing, for instance, then we'll be supporting them and getting those needs met and those types of things. So we really look at this as a very holistic, let's get this person stabilized and then bring them back into the fold to be supported long term. Next slide. And I believe that might be all of my slides at this point. So any questions for now? Any questions on the referral process, filling out the form, anything like that? Again, I'll be here the whole meeting. So if you do think of any questions, I'm happy to answer those.
We
I
do
see a
actually have
question.
a question. Yep. What is the
Yep. So
availability of interpreter services for PBC clients whose first language is not English?
that is a fantastic question. Right now, we're just allowing the providers to use their interpretation services, and we do have client or providers that speak Spanish at City University. So again, I would just send them over, and then we will work with them to get them the best fit that we can. The process right now has been very streamlined, very smooth, but we do have a few providers that are able to support that. And then again, if they don't have interpreter if we don't provide interpreter services, but the providers actually do have that at the various locations where they work. So if you have any specific questions about language or referral, please do send them over and we'll work with them.
All right. Any other questions, comments? All right. Thank you so much, Charisse. And, again, feel free to reach out with any questions or concerns or, queries about patients and pro bono counseling. So thanks so much.
Absolutely. Thank you.
I am going to be covering premium assistance. Yesenia Mendoza Ramos is our lead for that, our navigator lead. She is right in the middle of open enrollment right now, so I said I would just cover this piece for her today. So premium assistance is a somewhat seasonal program at Project Access. It happens during open enrollment, which is November 1 through January 15th. And it is a program in which we received funds from our hospital partners to provide patients who maybe don't qualify for Medicaid, but also can't afford to pay for a full premium. We pay for that premium for them for 1 year. And so patients do come through the hospital systems, financial advisor people, and they will refer to Project Access to get those patients connected and enrolled. Our current funders this year are CHI and Multicare. In order to get the qualifications, the patients must be at 300% of the federal poverty guidelines or less. They must be able to purchase on the exchange using tax credits, and they have to come through one of our hospital partners, so they can't self-refer into that program. And that's basically premium assistance. So it is underway, and we are getting quite a few applications for it this year. So it's very exciting stuff. Any questions on premium assistance? All right. Next, we have one of our new programs. This is our Community Resource Connection program, and I'd like to introduce my new colleague. I'm so excited. V. Mai. V hails from Washington State. She got a bachelor's and a master's in health administration from the University of Washington. Has extensive experience managing programs and was the executive director of the Midwives Association in Washington. So welcome to V. Very excited to have her on board, and she'll be talking about our new program.
Thank you, Molly.
You're welcome.
Hello, everybody. I'm excited to be a part of Project Access. As you all know, this is a great organization. So just excited to contribute to the amazing work that these people do already. So I'm going to be introducing our new program called the Community Resource Connection. This program is part of the Medicaid Transformation Project from the Washington Healthcare Authority. And Project Access Northwest through this program is part of Healthier Here's Community Hub. Community Resource Connection, or CRC for short, addresses health-related social needs of individuals residing in King County, regardless of their immigration status, housing status, and insurance status. So although we are part of the Medicaid Transformation Project, you do not need to have Medicaid or insurance to for us to work with you. So the Medicaid Transformation Project, or CRC, is part of Washington's Section 1115 Medicaid Demonstration Waiver between HCA and Centers for Medicare and Medicaid. Healthier Here's Community Hub, which is what we are a part of, consists of 17 case management partners. We are one of them, that collaborate to assist clients with resource needs. And because we are a part of that network, we have community health workers that offer services in multiple languages. So if you have a client who is, hesitant to reach out because they don't know if we can support them in their language, please still do, because the chances are we will be able to offer that. And if we don't have a community health worker that can speak that specific language, we also have interpretation services through Project Access, as well as the Healthier Here Community Hub. And so again, to kind of wrap that up, CRC provides comprehensive care coordination, resource navigation, and referrals to services that meet critical social needs, contributing to your client's health. Next slide, please. All right, so this is a brief slide just to show you who your clients will be working with and talking to on the phone or communicating virtually with. I am the Community Healthcare Coordination Manager, and then our two amazing CHWs, Brooklyn and Julia, are the ones that are speaking with clients every day. I'm mostly out in the community to gain those connections with community members as well as community organizations. But these are our direct phone numbers and email addresses. If you ever have any questions, feel free to reach out. And my information is also on our website. Next slide, please. So how to refer to community connections. Clients can self-refer or be referred by one of you, our community partners. We have an online form that's easy to fill out. It takes less than 2 minutes. You just put in some of their information and their needs. They are also welcome to call this hotline from Healthier Here, who will connect your clients to one of the 17 organizations. And if you do connect any patients or have them self-refer, please remember to select Project Access as your organization so that our CHWs can help your clients directly. And that way it's easier for the clients to be referred to our other programs that Project Access offers as well, like pro bono counseling or specialty care coordination through their primary care provider. So after the client self-refers, or if you help them refer, Healthier Here will review their intake form, and then they will send it to us, and our CHWs will contact the client within 24 hours of receiving the intake. So we want to make sure that the needs are addressed as soon as possible, regardless of what they are or who the client is. So again, it's on our website. If you have any questions or need assistance with the form for any reason, feel free to reach out to me. Next slide, please. Okay, and last but not least, since going live in early October, we've opened about 32, I believe now 34 cases, and are serving clients throughout King County. Our top client needs are housing or rental assistance, financial instability, transportation, food access, and behavioral health, which is why it's important that we, try to integrate our programs and work with Sharice and the pro bono counseling. And although these are the top needs, most of our clients have more than one need that they would like to address. So our CHWs work really hard to, try to coordinate all of those resources for our clients. And we are continuing to engage with community members and stakeholders through our outreach events. So if any of you have any events that you think your clients or patients would benefit from us being there, please feel free to reach out to me. I always love going out to the community. And with that, I will pass it back to Molly.
Thank you so much. We actually have one excellent question in the chat. Is this for King County only? So V's program is for King County only. King County is fairly large, so it still encompasses quite a bit of space. We do use Unite Us, which is a very similar program, less hands-on, but is a similar program for resources for Snohomish and Kitsap counties. So there still is availability for patients to get connected with resources through Unite Us if they need them. Any other questions for V? All right. Moving on to dental. So this was very exciting. We had our last referral coordinator meeting, which was in May. We were right on the verge of signing a contract with Arcora Foundation, which is part of Delta Dental, to take over their Dentist Link program. That has since been done. We have gone live with new staff members to take over the Dentist Link program. And I am thrilled to introduce a new colleague again, Kernal Parsania. Kernal is a dentist, a general dentist, with a master's in health administration from Purdue University. And this was just a perfect fit for her. And so we're very excited to have her on board. So I'm going to pass it over to her to explain a little bit about Dentist Link.
Thank you, Molly. And as the Molly said, this program is new Dentist Link. So as you know, my name is Krindal and I am from Project Access Northwest, and my position is Manager Care Coordinator. And let me take a moment to introduce you to Dentist Link, a service that plays a key role in improving access to oral health care across the Washington state. Dentist Link is provided by Delta Dental in partnership with Acora Foundation, which is a nonprofit organization dedicated to improving oral health and promoting health equity. The foundation works alongside communities to prevent oral diseases, transform health system, and enhance across to care for everyone. So the mission of Dentist Link is simple but powerful. Like we aim to connect patient with Apple Health benefits to local dentists who accept their insurances, making dental care more accessible for individuals across the state. So, like Dentist Link provides free referral services throughout Washington state. patient can self-referral by visiting our website like at www.dentistlink.com, where they can easily search for dental providers or receive personalized assistance via phone or text messages. And this service helps ensure that everyone, regardless of their background or where they live, has access to the dental care they need to maintain good oral health. Next slide, please. Okay, so now I am moving forward to our care coordinator services. Like, we understand that accessing dental care can sometimes feel overwhelming because all are not accepting Apple Health insurance. So, which is why we offer care coordination services to make the process easier for everyone. So, our care coordinators are available to assist you by text or phone. And if you need more specialized care, we can connect you with not only general dentistry providers, but also with dental specialists to meet the specific needs. So our process, how the process works, like for clients. So when the client reach out to us, a referral specialist will answer the call. But if they are not available, so a referral specialist will return your call or text. If they are unable to respond immediately, so they will get back to you as soon as possible. The referral specialist will ask a few questions regarding like basic information like your first name, last name, age, and where the client's living, like location, basically zip code area, so we know, and the dental needs. And after that, we will provide match the client with a dental provider that suits their requirements. We also want to make sure like language is not barrier to accessing a dental care or like any care. That's why DentistLink offers interpreter services for clients who are not English speaker, ensuring that you like clients receive the support they need no matter which language. We are here to help make the process as smooth and accessible as possible. So, like clients get the care and the deserve. So, like, and our staff member, one of staff member is Spanish speaker. So we are happy for the like we have diversity in like languages as well. So I move forward to next slide. So this is the staff of DentistLink program. I would like to introduce our DentistLink team. I have amazing two teammates like Ivan and Alendra. Ivan and Alendra works directly with clients to ensure they are connected with right dental resources and the dental needs. So next slide, please, forward. Let me walk through the key statistic for our clients' interaction during the period of October to November. So during this period, we served 662 clients through direct phone calls. This shows a strong engagement and willingness from our clients to connect with us for support. And we also received 72 text referrals indicating that my clients prefer a quicker and more convenient way to reach out to us via text. And we have 312 clients reaching out to us directly via self referrals. This is a positive sign as it shows individuals are actively seeking the services like we provide and talking in initiative to connect with us directly. And we have some partner referrals as well, like 84 partner referrals. Like our partners in the community continue to play an important role, like directing clients to us in services. And in total, like we served almost 1130 clients through these different contact methods during this period. And this reflects a wide range of engagement and highlights the trust and resilience our clients have in the services we offer. Like we are providing, like we have time frame like 9 to 5 we are providing our services. So after that we have some voicemail, so the next day we are doing all the voicemail, get back to as soon as possible to the client, and we call them and provide the dental references for them. And thank you so much for all your time, and we look forward to continuing to build on these positive trends. And again, I hand over to Molly, and if you have any questions, so feel free to chat.
Thank you so much. Nice job. Any questions about the Dentist Link program? This was an existing program prior to us taking it over, so it may be one that you are familiar with. And it is statewide as well. All right, if you have any questions, feel free to reach out or to put those questions in the chat. All right, I am going to go to the next slide. I'm sure this doesn't need to be said, but I thought I would reiterate, please don't send us any immigration paperwork for any of the programs if you're referring a patient in. We don't ask for this information. Our providers don't ask for this information. We would rather not have this information in our system. So just as a reminder, not to send that to us. And if you have any questions about any of that, please reach out. Okay, what I wanted to do next was just do a quick, I'm going to stop sharing this, and I'm just going to go into our website. I just wanted to show you a few of the very exciting different ways that you can refer patients through our site. Can you see my screen? Yep. So if you are on the Project Access, nw.org is our website. And if you're thinking, gosh, I have a patient who maybe would qualify for counseling or dentist link, or they need transportation services or housing, this is just a great place to come. And what you would do is look under our programs tab. And here are all of our programs in just an alphabetical order. And you are welcome to go into any of them and find out more information, or for the programs that patients can self-refer into, to go ahead and do that just from the site. So specialty care coordination is not something patients self-refer into. Those referrals need to come from a primary care provider, but there is just the general information about it. So if you're looking for that, for Community Resource Connection, again, here's more information, but there's also a Get Help Now button, and that will take you directly to the application through Healthier Here. Again, we do want to choose Project Access from the top questions so that we make sure that we are connecting you correctly. And then our Dentist Link program, you can go through this. You can either just request help directly from Dentist Link. So this is just a form that the patient can fill out, or you can help them fill out, and then someone will reach out directly to them, or they can just look through the directory for a dentist that specializes in what they need in their area. So either way of that is fine. Premium assistance is not a self-referral program, but if you have more questions about that, or your providers do, you're welcome to come in here and find out more about that. And then pro bono counseling, as Charisse talked about, they have enroll as a patient now or learn about the program. You can also volunteer from this page. So there's just lots of different ways to get patients connected to the different programs through Project Access. Any questions on that? Any comments from staff? Anything you want to
Yeah,
share?
I'll just,
Yeah.
this is Sharice. I'll go in
Yeah.
and just share really quickly on the pro bono counseling page. There's also a bunch of resources that we have listed for crisis, as well as just general resources in the community that we connect with. And we do send this out every time a client comes through to us. We make sure that they have that list and are able to connect with them. Also up here, we have a reiteration that if they're experiencing suicidal thoughts and any thoughts of self-harm, these are the things that they can do. We also have assessments through Mental Health America, just so that they can feel more comfortable with what's going on with them and find out more information about some of the things that they may want to talk with their therapist about. And all of that is listed below. We also have our Ask a Therapist blog that individuals can contribute to as a therapist or counselor, or they can actually ask us a question and we will answer that to help build community and destigmatize behavioral health. So I'm very proud of those parts as well. Thanks, Molly.
Yeah, thank you, Sharice. Appreciate it. So that is a way to get patients connected. For those of you that are referral coordinators in a clinic, don't forget up here on the right is a blue button that says RC. This is no longer password protected. It used to be, but it's not now. This is everything you could ever need to know. So referral coordinator meeting that is happening right now, as well as our optional Zoom. Anything that you need for medical referrals, if you have questions, any questionnaires that you need to fill out, federal poverty guidelines, and enrollment forms that are now updated to the new ones. So, yep, so that is the website. Are there any questions about how to find ways to refer patients, etc.? And if you have any moving forward, please feel free to reach out. I know this is just a lot of information. So just a few more slides. Get back to the right page. One second. As it pulls it back up. Okay. So, make it, all right. The last few were just scenarios. So we were just talking as a group about how we're working really hard internally to be able to very seamlessly transfer patients between programs as they need it. We are not all in the same system, so it was a little bit challenging, but we think we have a pretty good system in place. We've been practicing getting patients from one program to the next. So we just were talking about scenarios that we've run into to kind of patients that have multiple needs, how to refer them the most easily into the program. So you can use if you are making a specialty care referral, really easy. You just use the same system you always have and fill out the second form for community resource connections. And you can refer to the dental program, the pro bono counseling program, or any other program through Project Access on that page. But we also have, like I just showed you, our website with just different programs on there. So for the ones that patients can self-refer into, feel free to use that as well. So here are some scenarios. So the first one is my client is being referred to specialty care coordination and has shown an interest in counseling and housing support. How do I refer this patient? So this is a pretty standard way to refer, which I think most people are pretty familiar with, which is you just make the normal specialty care referral and then use the second page as the community resource connection page to request pro bono counseling and housing support. And then those programs will reach out separately for that patient. The second one we had, my client does not require specialty care coordination, but does need dental services. but they have a lot of anxiety about visiting the dentist. So how can Project Access assist in this situation? So in that case, we would refer you to Dentist Link and to Pro Bono Counseling for the anxiety assistance. And both of those can be referred directly through our website, again, under the programs piece. They can just go in or you can help them go in and go ahead and self-refer into those programs through our site. I have a client. My client needs dental and cardiac clearances for an upcoming orthopedic surgery. How can Project Access assist this patient? So if they're already a specialty care patient for an orthopedic procedure, you can just put in a new order for a cardiac clearance, and we can coordinate that part through our cardiologists. And then use the community resource connection to request dental services for the dental clearance, or the patient can go into the website and request that through Dentist Link. And again, the Dentist Link program would reach out separately. This one I'm going to actually hand off to Charisse if that's all right. But the question is, I have a primary care patient who needs counseling but has complex needs that may require medications. How can Project Access assist in this situation?
Awesome. Molly, could you go back to that other slide? I think it's,
This one?
I don't see, let me see.
I think there's a delay on this, so I
Yeah,
apologize.
that's
I'm
okay. There we go.
There we go. Okay.
Perfect. So yes, a primary care patient who needs counseling, has complex needs that may require medication. How can we assist? So I would still encourage you to have them fill out the pro bono counseling enrollment form that's listed here in the other section that I have the screenshot there. Just select other and then type that information into that box. And then our care navigator will reach out to them, complete the screening, and potentially connect them with outside resources or one of our med providers that we do have on staff that will support them. Again, we just want to make sure that the needs that they have are something that our med provider can support. And if not, we will still do that case management piece. There are providers in the community that we have been referring to for medication management. So please don't shy away from sending over a client, even if you feel like those needs are complex. It's up to us to do that case management piece. And if you put yourself as someone on the form that you'd like to be reached out to, just to make sure that that coordination is taking place, we will follow up with you to let you know how that client is doing and what if we were able to meet those needs for them. But we definitely want to keep them coming our direction and make sure that they know that they do have that support from us, because they do. And you can also reach out to me directly prior to filling that form out. I've been getting a ton of outreach from various providers in the community just asking questions, giving me those specific details and all of that. And I've been able to provide that support. You can also reach out to the behavioral health email address that's listed there. And myself or Dennis, our new fantastic care navigator, will also be able to provide that support. So again, send them over our way and we will work with them to get them their needs met. The goal here is to increase the amount of providers that are able to provide that medication management. But for now, we still don't want to turn those clients away. We will support them.
Amazing. Thank you, Charisse.
Yeah.
And I do want to just reiterate that the community resource connection piece, we do have the kind of warm handoff case management more piece for King County, but we do have other resources for Kitsap and Snohomish. So if you fill out that second page of the enrollment form, um, or if you enroll a patient on the website and they live in Kitsap or Snohomish counties, we will just internally refer them to Unitas. So if you have a patient or they're on the border and you're not really sure, go ahead and just enroll them and we will follow up separately. Any questions on any of these scenarios? And if you do have a patient with multiple needs and you're not sure how to best get them to the right place, please just reach out and we can help you. So that is the end of our meeting today. Curious if there's any other questions, thoughts, ideas, or needs. And it's hard to believe, but I hope everybody has a peaceful holiday season. It seems like we are there already, which is just kind of amazing. So any questions, ideas, any specific needs within the community that we can help you with? All right. As an FYI, Project Access will be closed over Thanksgiving break, the 28th and 29th of November, and then from the 23rd through the 2nd of January. We will have our offices be closed during that time. So, oh, I have a question from Vanessa.
Hi, I do have a question
Yeah.
regarding the program premium assistant.
Mhm.
So the patient needs to be referred by any of the founders, right? Do they have to ask or?
So they would go to the financial advisor piece at it's either CHI or Multicare. And Multicare is mostly focusing on Spokane, but they are welcome to ask about it and see if there are still spaces available. And Gary, did you have something to add to that?
No,
Oh, okay.
not,
Sorry, I saw
yeah,
you come off mute. So,
not not to that piece at all. I was gonna,
okay.
if you're done there, just wanted to thank Michelle, of course, for her wonderful comments, but also wanted to reflect that back to each of the referral coordinators that are on today's call. It's also because of your partnership and because of the community that we're part of that we can do the work that we're doing. But we know that we're all doing the work together. So each of appreciate the applause on behalf of our staff, but want to turn that applause right back around to everybody else who's on this call.
Yep, we know you guys are working hard under increasingly difficult circumstances. So really appreciate everything that you do, and I'm really proud to be your partner. So please reach out anytime with questions or needs or anything else that we can help you with. And unless there's anything else, that is our meeting today. Again, I'll follow up with sending out slides, enrollment forms, etc., and a meeting recording as soon as I have that ready. All right.
Perfect. Thank you so much,
Thank you,
everybody.
everyone. Appreciate your
Thank
time
you.
today. Thank
Thank
you.
you.
Bye.
Bye.
Bye-bye.
Bye.
Thank you.
Thank you.
Thank you.